Friday here. I'm proud to have, this is our Centric Health sponsored segment. We have Dr. Bridge Bomby on. He's been coming on the show now for going on a year now. I've been using Dr. Bomby to spend a lot of time on this coronavirus to kind of put these issues in layman's terms where people like me can understand it, people like you and me. We are joining us with Dr. Bomby is Dr. Kyle Heber. He is the head of the COVID response for Centric Health. I want to welcome both Dr. Heber and Dr. Bomby. Welcome, gentlemen, to the show.
Richard, how are you?
Okay, they're both of them. So they're on separate lines. We'll have to monitor this. Dr. Heber, let's start with you first. Did I get the pronunciation of your name right? Is it Heber?
You did. You did great. A lot of people want to add an R in the middle of it.
Okay, good. Excellent. Tell me something about yourself. How long have you been with Centric Health, and what's your story?
Well, I'm born and raised in Bakersfield. Went away for about 10 years throughout all my education and found my way back. Internal medicine residency at UCSF Fresno, so I came back to the Valley. And then came back here, and ever since I've been out of training, I've been working here at William F. Baker and Associates, which is a primary care internal medicine division of Centric Health, for a little over 2 years now.
And what does it mean when Dr. Bomby told me that you're head of the kind of the COVID response for Centric Health? What does that encompass?
Well, it was a role that I just stepped into, really, because when this rolled out and became a public health crisis, we needed to be able to deliver care for patients, and we needed to be able to see people as internists to take care of them, and a lot of that requires hands-on care. So I was very integral in rolling out the telehealth so that we could see people remotely who were high risk, but also developing protocols to bring people into the office safely, and basically orchestrating testing across Centric Health for any employees or physicians that have had concerning exposures or developing symptoms, and managing those patients too. So it's a lot of hats that I've just kind of stepped into.
Yeah, no kidding. All right, let's go to Dr. Bomby. Dr. Bomby, how are you today, sir?
I'm very well, Richard. I'm a little concerned about the integrity of our line, so I hear a lot of static.
I'm hearing a little bit, but JR, are we okay, you think?
I think so.
Yeah, I think we're okay. Don't worry about it. Dr. Bomby, give us a capsule summary here. And I don't know, can you guys hear each other? Dr. Heber, can you hear me conversing with Dr. Bomby?
I hear you very well. Dr. Bomby's a little soft, but I can hear him.
Okay, very good. Dr. Bomby, where are we in this latest wave of the pandemic? It just seems, I don't care if you're in North Dakota or South Georgia or Texas or Philadelphia, we're just getting hammered across the country. What's the situation here?
I think the pandemic fatigue has really taken hold of us. I talk to a lot of intelligent human beings, and they say, okay, what are my chances if I get the infection? I'm going to make it. I have 99% chance that I'll make it. So it's kind of a reasonable logic when you say, I have a good chance I'm going to make it, but it's a very flawed logic. Because when a person goes for bypass surgery, he has multiple blockages in the arteries. His chances of making are 99%. But in the bargain, the payoff is he's going to get cured. He's going to have a significant intervention that's going to change his life for good. Here you're sacrificing everything for nothing. What is the payoff when you die of COVID? You didn't get anything out of it other than maybe saved a vaccine. So it's also, if you look at the math, 1% or less doesn't seem much, but when you extrapolate it across the nation, you will have another 2 million dead people, and that's no way to construct a logical argument. It's just amazing to me when you look at the numbers from the 99% perspective, it sounds reasonable, but when you really do the math, on the 1% side, it's a catastrophe of unimaginable proportions.
How bad could it get here?
Okay, so that's something we are grappling with. It's obviously very bad from the infection numbers. So infection numbers were around 30,000 in the first wave, about 60,000 in the second wave, and now we're hitting 200,000. There's obviously a lag between the hospitalizations and mortality, which has been significantly reduced to evolve the therapeutics and the care that we are able to extend. The mortality rate, in-hospital mortality rate, is down by 70 to 80%. And more importantly, the length of stay is down by half the numbers. Previously, the length of stay would be 10 days or so. Now it's 5 days or so. So the pressure on the healthcare will be less purely from the improvement in the care perspective, but that can be easily undermined by the surge of utility, and that can exacerbate the mortality. When we talk about mortality being low, it's contingent upon the fact that healthcare system is there to absorb the needs. When the healthcare system is overwhelmed, then the mortality rate can go up. And that's the worry we have. That's why we keep saying, please, take the precautions.
Oh, absolutely. Let's go back to Dr. Heber. Dr. Heber, could you speak to all schools there's a huge debate, and I'm sure you've been following it, particularly in New York when they were getting ready to open the schools and they closed them again. And there's a line of thinking that says we should keep the schools open. That that it in fact being at school may be a safer environment than being at home or in your neighborhood. What is your take on that?
Schools is a tricky situation because there's arguments both ways, and it's a lot of it has to do. It's more than just about the public health concern. It's about financial and economic and social well-being of our youth and the parents. We were hit with this during the summer when schools were closed, so everybody was at home, and then and that was probably a bit an unexpected strain on parents. They were already had to have their kids at home anyway, but then the school year comes around and it impairs people's ability to be productive in their work if they have to be managing their kids at home, because young children cannot manage themselves on Zoom. I have 2 young kids, 3 years and 6 years old, and I do think that the schools should continue to reopen as long as they have protocols in place to minimize spread. My kids are fortunate to be in a private school where actually at the beginning of the year, school year in the fall, they opened at least at the preschool level, which is basically essentially daycare level, and then they slowly rolled it out through first grade through 8th grade, keeping kids separate, limiting class sizes, masks, decontamination protocols, kind of keeping children able to play with their classmates, but to enjoy themselves on the playground, but also kind of minimizing the mixing, keeping everybody in their little pods, if you will. Mm-hmm. And it's been working. They within the first week, the 5th grade class got sent home because one child got tested positive for COVID, and a few other siblings that were in other grades of students in that class also went home. But the protocol worked. There were no additional cases, and there have been no further scares now for 2-3 months. I think that it can be done and should be done because just it's going to have a tremendous psychological and sociologic and educational impact on our youth if we don't keep the schools open.
I would think that too. So would you be even with the numbers looking like they are? Would you be inclined to open the schools in January?
I still, even though the numbers are on the rise, it's a bold statement to make. But I think if the protocols and the assurity is in place, then I think it can be done. It requires a lot of social responsibility.
Uh-huh.
It requires a lot of parents and students being vigilant about any minimal symptoms, because children and adults alike can have very minimal to no symptoms. Obviously, you're not going to keep your kid home if they have no symptoms. There's
Sure.
no way you would know. But if you even have something out of the ordinary of their usual allergies, or if you're giving them their allergy medications regularly and yet they're still having allergy symptoms flare on top of that, COVID the possibility. And so it's up to the parents to keep their kid home, orchestrate seeing a pediatrician or finding a modality of being tested, and returning them to school when they're safe to prevent an outbreak, and being in communication with the teachers and staff so that the school administrators can keep the kids learning, but also do it in a safe manner. Fortunately, the less symptomatic you are, you seem to be less likely to spread. If you're not coughing, sneezing, running nose, there's not as much viral load that is going to be shed and passed on to others. And I think that's a big part of why kids don't seem to be a major vector, and also especially if they have no symptoms at all. But that's not to say that they don't, but it's just overall less. And I think that the grand majority of the spread is through too close of social contact between older adults and non-socially distanced activities.
Isn't that interesting? We're talking to Dr. Kyle Heber and Dr. Bridge Bombay of Centric Health. Dr. Heber, I've already asked Dr. Bombay in weeks past about this, but I want to get your perspective on it. What is it about people, and a lot of people here, who either look on this thing as a hoax or look on these sacrifices we're being asked to make as some kind of infringement on their personal liberties and take it as an affront or overreaching by the government, which experts will tell you will just allow the virus to grow? What's the psychology behind people resisting making these sacrifices, whether it's as simple as wearing a mask?
I think it's a misallocation of, in their mind, and that is their right, of priorities. And when the priority is on oneself and one's own civil liberties, and that is paramount compared to others' health and well-being, then I think that's where you have a lot of people that are saying, I'm not going to wear a mask, you're not going to make me do this or do that, I'm going to do things the way I've always done. It's not about you. It's not about you just as a person, although that is important to stay healthy, and granted this is a potentially fatal illness to a large portion of the population that is considered high risk. But it's also about your neighbor, your friends, your family, and not spreading it to others. And what you can do, although it may limit what you see as your inherent rights, can save others and save lives. And I think that that's important, but some people just don't see that way, or it's tough for them to conceptualize that.
Yeah, so interesting. Well, we should have some good news here. Let's go back to Dr. Bombay. Dr. Bombay, we've been talking about these vaccines for months now, and it looks like finally we're lining up. You have the Pfizer vaccine, you have the Moderna vaccine, you have now there was some positive news on the AstraZeneca vaccine. So this has to be good news, right? And what will be the challenges of rolling this thing out? And of course, everybody's going to be asking who gets it first and who's going to make those decisions.
So before I go there, I just want to reinforce what Dr. Heber said about the schools. Fortunately, in this divided nation, there's finally a consensus emerging, which is both bipartisan from political standpoint. CDC and other epidemiologic agencies, they're all saying school is the best option because the transmissibility in the schools is lower than what it would be if you were at home. In addition to that, even when the kids get sick, they get infection, they're less likely to get sick, and they're less likely to be infectable. They don't infect others that easily. So the schools for the kids is yes, yes, and yes, with the caveat that if there is an increased transmissibility in the community, an increased positivity rate, we have to have a backup system that we can contain the infections from becoming clusters and clusters from becoming breakouts. So having said that, on the vaccines, I'll reinforce what I said all the time, that the vaccines are an incredibly effective tool in fighting coronavirus, and we've been very fortunate because of the stable nature of the genome of this virus. And when we're seeing the light at the end of the tunnel, we shouldn't rush to steal defeat from the jaws of victory. The vaccine is an outstandingly, amazingly successful, effective intervention. As far as how do we roll out, I think it's going to be staggered because the demand definitely exceeds the supply, and there are logistical challenges in terms of being able to deliver the vaccine in the cold storages that are necessary. But the first people who will receive are obviously the healthcare workers. Even that, in healthcare workers, they'll be the ones who are more exposed, who are elderly, and stuff like that. And then it'll go to the nursing homes, then elderly people with multiple comorbidities, and so on and so forth. And there will be hopefully centralized, coordinated guidelines, and we don't need to reinvent this thing at every county level. But the faith and the hope and prayer we had in the development of vaccine has been answered for the good of humanity, and that's a great news for all of us.
Dr. Bombi, what do you tell people, and we've talked about this before, and Dr. Heber, you can join in too, but what do you tell people who say, look, I mean, the studies have shown that up to 50% of Americans they may take the vaccine, but they're very, very wary of it. And so many people have told me, I had this conversation last night, they said, well, you can't prove that something, if I take this vaccine, I may be okay today, but in 10 years, something could happen to me. What do you tell those naysayers about not only the efficacy of the vaccine, but the long-term safety of it?
So the long-term side effects typically occur within the first 3 months. So the 90 days is long enough period for, there are a couple side effects that are serious. One is the transmyelitis, which is infection or immunological involvement of the spinal cord that can make people paraplegic. And second is the Guillain-Barré syndrome. The probability of that happening with the flu vaccine is, for instance, is 1 or 2 cases per million. It's not like flu vaccine doesn't have side effects. It does. The hope we have in Moderna and Pfizer vaccine is that it's such a purified version. It has never been done before. The likelihood of contaminants causing an irresponsible immune behavior in the body and thus having those side effects is hopefully negligible to non-existent. So I'm leaning on the side of optimism that this is going to be a very effective and safe vaccine and more durable than the infection itself, because they have adjuvants in the vaccine that make the immune response more robust and hopefully more longer lasting.
Oh, that's interesting. So the long-term effects normally show up in the first 90 days?
Yeah.
That is fascinating. I didn't know that. Okay, we're about to run out of time. I got a final question for Dr. Heber. Dr. Heber, I'm so glad you came on. Dr. Bombi brought you on. I hope you come back on again. Dr. Heber, when you have your own patients and they say, look, I haven't seen my grandchildren in 3 months or 5 months. It's just going to be 6 or 7 of us, but people maybe we haven't seen for a while. What do you tell them, and what are you going to be doing yourself for Thanksgiving?
That's a very tricky situation, and everybody is different. Everybody's priorities are different. It really, I advise everybody caution, especially those who are considerably higher risk, and talking to the people that they're going to be around. If they are also going to be around people who for the last 2 or 3 weeks have been at home on Zoom, working from home, not doing anything more than going to the store with socially distanced and everyone is healthy, then I don't see anything wrong with a small gathering with some precautions in place and an altered Thanksgiving. But those who but going in as hard as it is to be around to not be around family and grandchildren and such, if people are concerned, then they need to keep their distance and find alternate ways to say hi and be there for social and emotional support, but maybe in a more physically distanced manner. In terms of my own plans for Thanksgiving, it's going to be small and low key with a family that we have been around, but is also being very aggressive in their socially distancing, and we're all very open and honest with one another about any potential symptoms or exposures.
Right.
So so we're all being very, very cautious.
Well, good. Well, look, Dr. Hebert, thank you for coming on with Dr. Bombi. Happy Thanksgiving to you. Dr. Bombi, always great to chat with you. Happy Thanksgiving to you. We will be.
I want to say, can I say one word
Sure.
about that, about the Thanksgiving? So a couple of very dear friends asked me about what they should do about the parents. So after due consideration, I told them, I have a split decision for you. It's 4-3. 4 says no, 3 says yes. It's agonizingly difficult decision, but my response is, if there are vulnerables who can have a fatal outcome, it's best to sit this Thanksgiving and Christmas out. Wait for the next one.
Absolutely. That's good advice. All right, gentlemen. And Dr. Bombi, it is, we will be off next week, so I will be talking to you in 2 weeks. And Dr. Hebert, thank you for joining us.
Very welcome, Richard.
Happy Thanksgiving.
Okay, happy Thanksgiving to you guys.